All right, well, let's jump into a Zika topic that's a little bit different than what we normally talk about, and it's about a study on the awareness and the specific knowledge that Americans have about Zika virus. Joining me now is Dr. David Abramson. Dr. Abramson is an associate professor at New York University's College of Global Public Health, and he's the lead investigator of the study. Dr. Abramson, welcome to the show, sir.
Oh, thank you very much, Robert.
Yes, sir. Okay, let's go over and just give me, what's the general purpose of your study? It's a 23-page document, and what was your general purpose?
So we began this really back in February after we started seeing the cases that were coming out of Brazil, and there was a lot of press in the United States, and we wanted to capture changing U.S. perceptions of the threat of Zika and people's appetite for different types of public health interventions. We assumed that over the course of a year, both the science would get better, we'd have a better understanding of Zika, and also that the incidence of Zika-related cases might increase in the United States, and we wanted to see if people's opinions and threat perceptions and salience of the risk changed. So we conducted and are still conducting a series of national probability samples where we draw about 1,200 people nationally, just the way the political opinion polls do. And then we ask them about these questions, about what they know, how aware they are, how much risk they think they're at for Zika, and then we try to get to their appetite for various types of public health interventions.
Okay, let's go ahead and jump into that. So what did you find concerning the general Zika awareness and the more specific Zika knowledge in your survey?
So to capture this notion of awareness, we simply asked, are you aware of Zika? So it's the simplest entry level you could have for being aware of the virus. And about 80% of the U.S. population is aware of it. And it's increasing. So it's probably by now it's at maybe 90%. So there's a great deal of awareness. We had seen a little bit of change over time, too.
Dr. Abramson, can I ask you, did you find the 80% to be unusually low considering all the coverage?
No, I actually thought that was about what I would expect to see. I think that people, most people would be aware of it, and 80% certainly qualifies as most. And then there are some people who are just not that aware of maybe health threats, things that are not present in their community, things that don't threaten them directly. And as I said, I expect that it's probably going to be up to about 90% at this point.
Sure. Okay. So, and the more specific knowledge.
Right, and in terms of knowledge, we asked people three aspects of the Zika infection to see if they knew about it, and they would have had to answer all three to qualify as knowledgeable. One, that you could be asymptomatic carrier, or you could be infected without having symptoms. Number two, that it could cause birth defects among Zika-infected pregnant women. And number three, that it could be sexually transmitted. So when we asked people that question, only 40% of the people, of those who were aware of Zika, so it's 40% of the 80%. Right. So only 40% overall of those aware of Zika had that level of knowledge. And that's a little bit more troubling. Because then there are some key aspects about the potential transmission routes that clearly people were not aware of, and you could imagine that might be related to their sense of risk, the kind of protections they might take, the behavior changes they might engage in, and their appreciation for different types of policies.
Right. Did you break it down by geography? I imagine somebody from Miami, Florida would be much more aware and I have more specific Zika knowledge than somebody from Boise, Idaho.
Well, we did, and we looked at it by region essentially, and we just sort of took large slices of the country, and so the Gulf Coast versus the middle of the country versus the north, and it was fair to say that those people living in the Gulf Coast were more aware and certainly, slightly more knowledgeable and they also thought of themselves as more at risk. So if about 30% of the U.S. population thought they were at risk, generally, on average, people along the Gulf Coast states, from Florida to Texas, about 40% felt that they were at risk. So there was a 10% bump, let's say,
Gotcha.
in the South.
Now, your study also demonstrates some political leanings and how they determine how people feel about certain public health interventions. What did you find?
So we looked at a number of interventions, but for the report, we looked at three in particular. One that was a behavioral intervention. Would you delay pregnancy for a year or more? We looked at an environmental intervention. Would you support government-run indoor spraying of homes with insecticides? And then a clinical intervention. Would you support access to federally funded abortion services? And so for the pregnancy delay and the indoor spraying, we didn't see the political ideology making a difference, but we certainly saw it, as you might expect, with the access to abortion services. So people who affiliated with the Democratic Party or who listed themselves as independent were anywhere between 2 to 5 times as likely to approve of or endorse abortion services for Zika-infected pregnant women. Perhaps that's not a surprise.
No surprise at all. So you're continuing to gather data, and how is the study and the continuance of the data going to be used for the enhancement of public health? How do you imagine?
Right. So, and in fact, there are several other major aspects to the study that we are engaging in, which is we're looking at the cues that people might pay attention to, and whether those cues come from formal media, whether it's broadcast or online or print, whether it's coming from social media and other informal types of outlets, whether it's coming from their personal doctor or whether it's coming directly from some type of government campaign, whether it was a public service announcement or brochures, whatever. So we're trying to understand, how do people separate the signal from the noise, and does it relate to the types of attitudes, perceptions, and appetite for different policies? So that's one big thing that we're still working on. The second thing that we're doing is that as we're going along, we're advising a small group of high-level public health officials what we're finding as we find it out. I'd like to believe that these kinds of pieces of information would be useful to those who are risk communicators. One of the things we suggest is that people think about how to make a more tailored and targeted message to reach the kind of populations that they need to, depending on what the particular risk is and what they want to achieve.
I know you're in a hurry, and I'm going to let you go. Let me just squeeze in one more quick question. Was there one method of message delivery that has been the most effective that you've seen so far?
Well, it's not that there's one that's the most effective, but we were a little bit surprised to see that that awareness seemed to be associated more with conventional media than social media. And I guess I was expecting to see more of the power of social media to broadcast at least general awareness, whereas we found that people who relied upon conventional news sources as their primary source of health information, rather than looking at Facebook, Twitter, Friends, etc., were certainly more likely to be aware and knowledgeable.
Interesting.
So, if anything, it's a tribute to the old-style media.
I guess so. Okay, that is a surprise. All right. Well, Dr. David Abramson, thank you, sir, for your time and expertise, sir.
Great. Thank you very much.
All right, good night. And I'll be taking the study, and I'll be linking to it when I publish the podcast on Monday evening. So you'll be able to check that out for yourself. It's very interesting, and it's not a difficult read, and I encourage you to check it out. It's good stuff. All right.